What's up, guys? How's it going? Cade Moore with More Muscle. Today we're going to be talking about something that I've seen increase recently, and it's kidney disease. So guys, the kidneys, they filter your body. They remove waste and balance your body's fluids. And they help with a lot of things. And basically, if your kidneys aren't working, you're going to have waste build up in your body, and you're not going to make it. You're not going to live. And actually, I've worked in the hospital a little while, and 2 days in a row we saw about 50-year-olds, 60-year-olds, and they came in. They had taken a ton of Tylenol, and then they were outside all day, and they didn't drink any water, and they got really dehydrated. And then they started feeling woozy, and they came into the emergency room, ended up in the ICU. And a lot of that time is from when you're taking too much, even simple drugs like Tylenol. They can build up, they can hurt your liver, they can hurt your kidneys. And when that stuff doesn't filter out, it's going to cause problems. So we saw this twice in a row. We saw 2 really hot days here in Utah. These patients came in, they had taken a bunch of Tylenol, and one was a construction worker. And he took a bunch of Tylenol, and he worked a ton. And guess what? Because of all that Tylenol he took, his kidneys stopped working. So guys, this is terrible. Because once your kidneys stop working, you have like 6 months to live, basically. Or you're going to be on, what's it called? Dialysis for basically the rest of your life. Dialysis is basically an artificial kidney. You go into a room, you hook up, they hook up your blood, and they filter it out for about 4 hours. So guys, tons of heat and tons of Tylenol is very bad. It can be harmful on your kidneys. And any drug, honestly, any drug, a lot of them are, excess amounts. Their kidney, they're nephrotoxic, which means kidney, the kidneys can, break down from them. So guys, chronic kidney failure, let's talk about this. Your kidneys, obviously, like I said, filter waste and excess fluid from your bodies, which then remove in urine. So dialysis, like we said, dialysis can help you filter that, help those kidneys if they're not doing their job right. I did dialysis for a little while. Not me personally, but I was working in dialysis. Very fun, very easy job. You literally just sit there and watch dialysis patients and make sure they don't have any reactions or whatnot. So, dialysis is an easy job if you're in the healthcare. But you obviously got to look for symptoms if that dialysis patient starts reacting, because that's definitely possible. You can have you can basically pass out because of the loss of blood, and so there's a lot of other symptoms and problems you can get from having your kidneys not working. So guys, we don't want to harm our kidneys. It's not something that you want. Some symptoms include nausea, vomiting, loss of appetite, fatigue, weakness, sleep problems, urinating more or less, decreased mental sharpness, muscle cramps, swelling of the feet and ankles, dry itchy skin, high blood pressure that's difficult to control. So guys, the kidneys actually control the blood pressure. So shortness of breath, chest pain, and so guys, the kidneys are extremely important. Without them, you're basically dead. So for another example, when I was doing dialysis, we had a patient. He came in and he basically said he had no appetite, he couldn't move, and the first time he ever did dialysis, the day after, he had a huge appetite and he could actually move around and walk. So that's how important the kidneys are. When they're not working, your appetite's going to go away, and you're not going to be able to move as well. So guys, you want your kidneys to be functioning, and let's get to it. So some causes, guys, for kidney problems. So type 1 or type 2 diabetes. Guys, I've said this in my previous videos, but once you have diabetes, your risk for every health problem like goes through the roof. So it's not something you want. High blood pressure, guys. So basically, when your blood pressure is high, it puts more pressure on the kidneys, and your kidneys can shut down from too high blood pressure, which can be very, very problematic. So you can have inflammation in the kidney. You could have inflammation in the kidney's tubules. You could have polycystic kidney disease. That's when basically I think it's when the kidneys like have scarring on the top of they scar over and then they don't work as well. You could have prolonged obstruction of urinary tract. And you could have a condition that causes your kidneys to back up, and you could be also having like kidney infections, which are definitely problematic. So let's talk about some risk factors. So guys, these are the things that you don't want to do. So diabetes, guys, type 2 diabetes is controllable. 95% of diabetes is controllable with diet, exercise, and sleeping well. So guys, diabetes is a risk factor. You don't want diabetes. That's going to put more pressure on the kidneys, and you don't want diabetes. The next thing is high blood pressure. Excess salt, obesity, inactivity, sedentary lifestyle, that's all going to lead to high blood pressure. Too much stress, heart disease can also be a risk factor. Smoking, guys, smoking is a choice, just don't ever smoke. Obesity, family history of kidney disease, and abnormal, obviously you can't change family history of kidney disease, but you can change obesity, smoking, high blood pressure, and diabetes. You can definitely change that with hard work and going to the gym, exercise, and old age. And okay, look at this one. It says frequent use of medications that can damage your kidneys. And guys, I hate to say it, but almost every single medication, even the over-the-counter medications, if you take too much of that, they're going to be harmful for your kidneys. When I was in my pharmacology class, almost every single medication that we talked about was nephrotoxic, which is kidney, it can cause kidney problems. So guys, that's what a lot of people don't know this, but frequent use of over-the-counter medications can cause kidney damage, right? So like I said, those two people that I saw, they had been outside in the sun, they were dehydrated, and they had taken a ton of Tylenol. And basically, you want your creatine level to be low, around like 0.6, I think, to 1.2. There was one guy's creatine level that was 10. So I think it's every point, like one whole number, your kidney has to work like twice as hard. Don't quote me on that, but it is somewhere around there. Your kidneys have to work so much harder when that creatine level is higher. Your creatinine level is higher. And so you want that level to be around, I think, 0.6. Let me look it up. I think it's 0.6 to 1.2. Creatinine normal level. Let's see. So we got, so 0.6 to 1.1. Sorry, my bad. For adult men, it's 0.74 to 1.35. For women, it's 0.59 to 1.04. So you guys it's about like 6 to 1.2 is where you want it. So you want that creatinine level. That's basically the buildup of toxins in your body. So you want that low. If it's low, that means your body's kidneys are flushing out all that junk, and that's going to help out. So what happens when you get kidney disease, guys? This might scare you, but it could cause fluid retention. It could cause a sudden rise in potassium levels, and it could cause hyperkalemia. That's high levels of potassium, which can impair your heart function and can be life-threatening. So guys, there's a thing called hyperkalemia and hypokalemia. They're very life-threatening. Potassium helps the heart function when it's out of whack, when it's too high or too low. That's going to cause your body, harm. The next thing is anemia, heart disease, weak bones, infertility, damage to your central nervous system, decreased immune response, pericarditis, and inflammation in your heart, pregnancy complications, and irreversible damage to your kidneys. So guys, pregnancy complications, when you have a baby, or when a woman has a baby, their body has to do like twice, they have to do extra work. So sometimes they can put extra stress on the mother. Now guys, listen to this. This might save your life. I actually have even family members that will take Tylenol and just pop pills like it's nothing. And let's see this. To reduce your risk of developing kidney disease, you want to follow instructions on over-the-counter medications. So guys, over-the-counter medications are drugs that you can just go pick up at Walgreens, such as aspirin, ibuprofen, acetaminophen, Tylenol. And taking too many pain relievers for a long time could result in kidney damage. The next one is maintain a healthy weight. So guys, when you have excess weight, your kidneys have to work extra. Your whole body, your heart has to work extra. Your blood pressure might increase. So you want to maintain a healthy weight. Don't smoke, guys. Cigarette smoking can damage your kidneys. So guys, just don't smoke. And manage manage medical conditions with your doctor helps. So like those diseases that will make your kidneys, like high blood pressure, that can cause kidney problems. That's what you'll have to do. You need to manage those high blood, you need to manage that high blood pressure. So what they'll do for you is they're going to test your blood, urine. They'll do some imaging tests, and they'll do a kidney biopsies where they remove part of the kidney and test it. Or just not the kidney, like tissue of the kidney, so it's just a small little part. They might give you high blood pressure medications to relieve swelling, medications to treat anemia, medications to lower cholesterol levels, medications to protect your bones, a lower protein diet to minimize waste products in your blood. Okay guys, this is something I want to actually touch on. So a lower protein diet to minimize waste products in your blood. Now guys, this is a big problem, I think, in today's world. We have lots of influencers saying, hey, you need 200, 300 grams of protein a day. Guys, look at what it says right here. If you have kidney problems, it says eat lower amounts of protein. So I think protein's a great thing for you, but 300 grams of protein might be causing your kidneys to work excessively, and that could cause your kidney problems, So I like that there's a lot of influencers that are trying to help people get healthier, but what I don't like is when they recommend false information. Too much protein can lead to excess waste products in your blood, and your kidneys will have to work harder. So that's a weird, interesting fact that a lower protein diet is recommended for kidney disease patients, because that basically puts less stress on the kidneys, and the kidneys can minimize waste products in the blood. So what you can do if you do have kidney disease, I'm sorry, that's terrible, but you can go for dialysis. It's very tough. I mean, dialysis is 4 hours, 3 times a week, and that's just, that's not fun. That's a big waste of time, especially if you can prevent kidney disease. Sometimes you can't, but there's sometimes you can, definitely. Another thing is a kidney transplant. So you can get a kidney from a different, body. Then you have to take medications so that your body doesn't react to that kidney, and those medications aren't fun to take. So I would do, those risk factors I talked about, I would try and follow those first before, try and avoid those risk factors and try and keep your kidneys healthy. Stay at a healthy weight. Don't smoke. Do those things that you can control. And then if you still get kidney disease after that, then I think it's very unlikely that you will if you take care of your health well. So anyways, guys, thanks for watching. I hope you enjoyed this. Subscribe if you feel like it. This is kidney disease. Thanks for watching.